everybody. Welcome to the Kinetics USA web show. Today, we're going to be talking about a really interesting topic, clinical transitional modules. My name is Holly Musselwhite. I'm the clinical nurse educator for Kinetics USA, which is now a part of AMN Healthcare. And we're pleased to get you to join us today. So I want to take a moment to let everyone sign on. Please tell us where you're joining us from. I see Mark is already on with us, and Fong is on, and Sterling is on. Good morning, and AJ. Awesome. We've got a great panel lineup here today. So I want to do some quick introductions with you who've been willing to join us. And it looks like I've already got one person, Yam Ne, who is joining us from the Philippines. So welcome. Glad you're on with us today. And then Rhoda's from Riyadh. So you're in Saudi. Hello. Very, very neat place to be, I'm sure. It's on fascinating to see where everybody's signing in from. So please let us know in the comments. And while you're doing that, we will start talking about who's joining us, and then we'll jump right into our topic. So Mark, if you don't mind, I'll start with you.
Yeah, thanks. And hello, everyone across the world. My name is Mark Jones. I am one of the clinical managers here in the office at AMN International. I am happy to join everyone today. So one of my roles is to kind of assist in that transition process for our nurses coming abroad to the U.S. in terms of their clinical transition. So I'm happy to be here today.
Thank you for joining us, Mark. And then next we have Fong. So Fong, I'm going to let you introduce yourself to our audience today.
Hi, good morning, everyone. I'm one of the we call that the traveler. I have been working about 11 months here. Yeah. So far, I'm so happy.
So Fong has had the chance to get to America after a very long process, I'm sure. And so she's now getting to live the dream, and she's gone through, I'm sure, a lot of interesting experiences as she moved here and began her work in the US and learned more about our culture and experienced it. And then AJ, I will have you go next, and then we'll have Sterl go.
Hi, good morning, everyone. I'm AJ. I'm a nurse, and I've been a nurse since like 5 years ago. And currently, I'm in Florida. I've arrived for about a month ago, and it was a good transition. So, still till now, I'm still adjusting with everything here. So, I'm still looking forward to a lot of things.
Very good. Yeah, AJ, so you're going to be starting your new job soon here in the US. So you're just kind of adjusting and preparing. So we're really glad to have you on today. And last but certainly not least, Sterling, if you'll introduce yourself.
Hello, everyone. My name is Sterling Gudger. I work for O'Grady Peyton International, AMN International, and I am our Senior Education Specialist. So I help our nurses get enrolled in their pre-arrival education modules through our online learning system, make sure that they get those completed before they come, and then assist with any as needed remediation items while nurses are on assignment in the US in regards to additional education. Happy to be here.
Thanks, Sterl. We're so glad everybody's joined us. I'm going to take a peek at the chat and see some of the other interesting locations that our nurses are in today. So let's see. Miguel is in Oman, Francis in Kenya, Evangel is in Nigeria. Gabriel is watching us live in Ghana, Carol in Kenya, Al in Thailand. Wow, this is awesome. So we have a lot of countries represented here today. Caesar's in the UAE. Anita, where are you? In Ghana, so another nurse from Ghana. Murtala from Nigeria. Arlene from beautiful Jamaica. It is a beautiful place. I've been there. It's lovely. Ghana, Kuwait, the UK. Mercedes from the UK. Laura Lane. So that's awesome. Thank you so much to everyone who's joining us today. I will check back in the chat in a little bit and see what other comments and things you want to share with us. And we're also in a little bit going to open it up to questions. But before we do that, we wanted to have some information shared with you from our panel here today about the topic. So we're going to start with some of the basic information about clinical transitional modules. Our organization and many others who help nurses transition from where they're working overseas into the United States will encourage you to do some clinical preparation before you get here. There are a lot of things that you're going to be tasked with to adjust to life, to settle in, and then also to start to get familiar and comfortable with in terms of different clinical practices, different policies and procedures, different, roles that the U.S. nurse may have that may be different overseas. So it's a lot of adjusting to do. And I hear people talk about drinking from a fire hose, and it's a pretty accurate description. But we want to help you prepare for that. So first off, Mark, if you wouldn't mind, tell us, for an international nurse, why it's important. You work with our international nurses from all different countries. Why is it important that they do some clinical preparation before they even get here?
Yeah, thanks. So I think the key is, and I'm sure many of you know from studying for your NCLEX, is there's practice differences when you get here to the US. Yes, you're coming as an experienced nurse. Some of you may have 20 plus years of experience, but that does not mean that you're going to be excluded for some of these practice differences that we see. That's why it's such a key to kind of work on these modules. Where you currently working, it may be a certain policy where you are not allowed to do something as a nurse that we do as a nurse routinely here in the US. So for example, IV insertion, one of those skills that some of our medical surgical nurses, it may be a physician responsibility in your current setting. Or urinary catheter insertion, depending on your gender, you may only be allowed to insert for a female patient, or you may only be allowed to insert for a male patient, depending on the part of the world you're coming from. So that's kind of why it's one of those key important differences that you need to practice on it, along with policies and procedures and things of that nature.
Absolutely. And Sterling, would you mind telling us, you work with the nurses when it comes to being assigned to some of these topics and things. What's the best time for them to work on this clinical preparation prior to their arrival?
Yep, thanks, Holly. So we find that it's best to work on these modules in advance of coming to the US. We assign a lot of our education modules months and months before you come to the US while you're in sort of an immigration holding pattern. It may be when you are interviewing with the facility, or maybe after you've already accepted a job, but we want to get you these modules assigned and completed before you're making those really urgent concrete plans to come to the US, because we know in the last month, 2 months before you arrive to the United States, you're going to be so busy tying up work overseas, getting personal things taken care of overseas before you move. It's such a stressful time. So we really want you to get these modules assigned and completed early so that you can retain the information. You don't have to rush through them. You can really absorb what the material is teaching you. As well as in the US, some states require you to have CE credit in order to get a license. So we want you to go ahead and get that CE credit so our licensure team can start working on your license, and that it's not a holdup or delay for you.
Thanks, Daryl. That's really good information. And I know occasionally we're popping up the link if you're interested in applying with Kinetics. It'll pop up there on the screen. And so you're welcome to check out that link, and maybe we can help you with some of the things that you're going to need to do to fulfill your American dream. The next question is for all of you. And the thing that I'm wondering is, what kind of topics are probably going to be the most useful? So maybe if each of you could give me a couple of topics that you think are going to be useful, or they have been useful in the case of maybe Fong and what she's dealing with. And actually, I think I'll start with Mark, and then the rest of you can kind of chime in after he shared a couple.
Yep. I think for me, I see so many topics that are really important for you to know as you come here to US. I think for me, my best piece of advice would be, what is something that you studied on NCLEX that is not a part of your daily routine as a nurse? You know your skills better than anyone else. So I can kind of pick different regions of the world where I can say this particular topic is probably a little bit more important than another. And obviously EMR, that will be probably the most important one for everyone. A little bit harder to get that, but know what your current skill set is and know where your the differences lie between what you studied on NCLEX.
Absolutely. So Fong, you've been here now for a while, and so from your perspective, what would you say are a couple of things that should be studied before you come?
All right. I think for the knowledge basis, everybody will be well prepared because you need to pass the NCLEX, everything. I have no problem that all our candidates will be, be efficient for that knowledge base. But there's one thing I want to, emphasize is the computer skills. Nowadays we all using the computers. So for my facility currently, we are using the Epic software. Yeah, it really gave me a hard time at the beginning. And even now, the mature staff, I mean, the local staff, they still having some difficulty, to find where to sign, where to find things, how to order. Yeah, I think that is one of the topic we should include.
I completely agree. Yeah.
Yeah.
EMR is big. And also, Fong, do you find that it's using the computer, but it's also that you may document things more exhaustively? A lot more information is probably going in there, but a lot more check boxes and things and prompts that you're being given based on what your information is that you're putting into the system?
Well, yes, the searching for all those, the place where you need to enter and where you need to find the information is a headache. Is a big headache.
Yes. And it's a necessary one. So if at least your actual comfort with the computer is there, I think that's important. And there are some modules that will expose you to some concepts of EMR before you get here. And then every system, you mentioned Epic, every system's a little different. And also, and that's because of where you work and what your policies are. Every system's a little different, so it can be customized. But there are some major players out there. Epic is very well known. Cerner is another system that's probably pretty well known. I think there's a couple others that come up kind of frequently, but those are two of the most well known. So exploring that, I completely agree, and it is a little bit of a headache, but you'll get there. And I think you're probably feeling a lot more comfortable now, right?
Yes, of course. Yeah, after so many times exploring.
Absolutely. Okay, AJ, you're not yet started here yet, but what things have you seen that you feel like they're really good to study before you get here? Oh, you're muted, AJ. There you go.
So, like for me, the most essential thing is the basics, the fundamentals of nursing.
Can you bring your mic up, AJ?
So for me, the most important thing is the basics because it's where we came from that we tend to just like overlook about it. So for me, the best thing is to know their basics because uh, theories and like the ways that you can see the patient, the signs and symptoms are quite different in comparison to your when you read a book or when you see it on a video. So you need to at least learn like the basics of your laboratories, for example. So you need to learn from it and just look where you would become comfortable to excel more and move forward to it. So just learn from it.
Yeah. AJ, you mentioned labs specifically, and I think that's really good to touch on because when you get here as a nurse, when you're at bedside, you're the eyes and ears for that physician, they're not usually as present here, and the nurse is really the driver of the care. So they're picking up on what those abnormal labs are. They're going and assessing the patient and looking at the clinical presentation and seeing what's different. And then they're having to follow up with the physician and give a very good, concise description of what they see, what the labs are, what the vitals are, what they think might even. They give suggestions for orders. Hey, doc, can you give me orders for this or that? Because I think it would be helpful. So putting all of that together, when you say basics, it is basic nursing. And so if you're rusty on some of those key things like labs or assessment skills, you got to get refreshed on that. Sterling, what about you? What do you think is really important to review before they get here?
Yep. So certainly those basic clinical practices, skills that we've all touched on. We have some great courses on medications and documentation, like Fang said, fall risk, lab values, like you mentioned, Holly. But I really love some of those soft skills as well. For example, customer service, time management, communication. Even though all of our nurses are English passed and trained, a lot of times the communication here in the US is very difficult because Americans speak so fast and the vocabulary can be different, as well as accents can be a challenge depending on what region you're working in. So we have a great communication course that we can assign to help with some of those soft skills, as well as customer service. That's a big difference in the US, that patients are treated a bit differently. Their expectations are much higher a lot of times. And then certainly the time management course. This is so vital for when you first get on the unit. Like we mentioned with the computer documentation, sometimes you feel like you're taking so much time on the computer trying to find something, trying to document something correctly. So that time management course can really help you prioritize your tasks.
Mm-hmm. Thank you so much, Sterling. So you guys have given some really great information. I want to move on to talk a little bit about how much time we might need to devote. Because, of course, everybody's busy. And so when you're saying, oh my goodness, I'm supposed to do something else in preparation, I don't just have to go get paperwork together for my immigration or my licensure. This is going to take some time from you too. So AJ, I wanted to ask you, in your experience, how much time it took you to complete the things that you were working on for your clinical transition.
Well, for my transition would be I made it a point that my minimum time would be like a week, but my maximum time would be 2 weeks for all the modules that I've been given, so that in that way I won't be lazy enough to just think that it would be after a month. So I made it a point because we're all busy and we know how stressful it is when you're tired and you don't have a timetable for all of it. So I made it a point that I'll be doing the modules in the morning. Then at the lunchtime, I would have a snack and have a rest or like a quick nap. Then in the afternoon, I would tend to answer the modules or till the evening if I'm still at the point of sanity of doing it. And yeah, I'm able to take a rest. Yeah, that's what I did.
Gotcha. So you took the approach that I'm going to really kind of get all of these things done in a tight period of time instead of stretching them out. Sterl mentioned that we try to assign it where you've got some time ahead of time, a few months, but we know that some people, they're like, this is when I can get to it, so I'm going to get to it now. It sounds like that's what you did. Fang, did you do the same thing? Did you try to block it off into a couple of weeks and get them done, or did you stretch them out a little bit?
Yeah, I think a bit the same, but I will do a time. I will do a plan. I will go in and see which module will take longer time. So I will use a bigger blocks of time to study on that. Yeah, I will be more flexible. One day I will do one topic, or the short modules I will do, two topic or three topics, so I can finish in about 1 to 2 weeks.
Mm-hmm. Okay.
Mm,
So you guys had relatively similar approaches. That's good to know.
yeah.
So it may be that the important thing is when you're initially assigned the modules, not to feel overwhelmed. They are doable. So if you look at your list and you go, oh my goodness, I got all these things to do, just take a deep breath. It'll be okay. And we have two experienced folks who can tell us that. All right, Mark, my next question is for you. What do hospitals and clinical facilities feel is important for the nurse? Why do they feel it's important to do that clinical preparation before the nurse even gets here? I mean, they haven't even started work with them yet. So
Right.
why is that important from the
You know,
hospital's perspective? Sorry.
I think one of the biggest keys is when you are coming here to the US, and sometimes you're interviewing with unit leaders, sometimes you're just kind of getting an offer. Oftentimes they are expecting an experienced nurse to come in to their unit, and you are an experienced nurse. Our models are to bring in our experienced nurses. So when you're talking to that manager, they want to see some of those skills come through. Now we do our best on our side to educate those managers in those facilities that yes, they are experienced, but there are some practice differences you need to be aware of as well that will result in you having a longer orientation than your typical contract nurse coming to a facility in the US. But that's why it's so key to prepare and work through those clinical modules pre-arrival. That way you can get that theoretical knowledge, you can see those videos, and now it's a matter of acting on those theories and those videos that you've seen. So that's probably the biggest key is those, like I said, the managers expecting an experienced nurse with time and within reason of being here.
Mhm. Yeah, I think that's great insight. Their expectation versus all of the things that you're adapting to, whether it's different equipment, the electronic medical record, how we package our care items into different arrangements. So there's so much that you're going to be learning, but there's still an expectation there that you come with a baseline, I guess, and that you take some of that experience, yes, a nurse is oftentimes, we know overseas, a lot of the nurses have seen the same textbooks you and I were taught with. So it's not that the material wasn't covered, but how it plays out in real life, it may be applied very differently here in the nurse role. And so starting to prepare for that, knowing the hospital's expectation is an important factor into, is this worth me doing it or not? The other thing I would add is that your preceptors that you're going to work with, they've never worked in a lot of these countries or have any idea what the differences are. So they may assume when you get there and they say to you, have you done this or have you done that? And you say yes, that they're like, okay, great. I got an experienced nurse. But as time goes by, they may realize you did do it, but you did it differently, or maybe the focus on that procedure was a little different, or your responsibilities were a little bit different, or how you document is a little bit different. And so at least if we use this to kind of bring you to a certain baseline, hopefully that helps you meet some of those expectations a little bit sooner and feel more confident. It's important to feel as confident as you can feel when you're starting something new like this. All right. So the other thing we wanted to talk a little bit about is you've done these transitions modules, and now you're going to arrive here and start your orientation. And I saw a question in the chat, which I actually think is a good one. So Angie says, are there modules to be completed when you arrive in the US before you start work? Or are you taken straight to the floor? So Mark, I'm actually going to let you answer a little bit of that because it's a great question.
Yeah, so that is a perfect question. So, from our perspective, we want you to complete the modules that we assign to you prior to your arrival in the US. The reason for that is one, to give you the knowledge and to give you the insights of how those particular interventions, skills, diagnoses may be looked at here in the US, but also two, because when you begin working here in the US, 9 times out of 10, the hospital that you are going to be working at is also going to have modules that you need to complete in those first week or two of your orientation period. And we call that general hospital orientation. There may be some facility specific guidelines and policies that you need to know and take modules on. Maybe you are going to a unit, for example, that sees a lot of bladder irrigation well, they're probably going to want you to take a module on bladder irrigation as well, whereas that is not necessarily one of our standard bundle modules that we would add in. So that's a great question to kind of give you a better insight into what it would look like once you work through those modules, both pre-arrival and in that first couple of weeks of general hospital orientation. That's typically when you get out to the floor and you start getting that hands-on experience.
Yeah. Thank you, Mark. So Fong, I wanted to ask you, how did the pre-arrival modules impact your orientation experience at the facility where you are?
Oh, well, as you go along the topics, you will definitely gain some different new knowledge. As Mark already mentioned, there are definitely some discrepancies between, each country. Yeah, so it will give you the ideas, about some of the differences that you might, face down in the day-to-day work. And yeah, I think I feel like the professional communication is really important, as Gillian mentioned. Yeah, it really helped. And the preceptor, the orientation with the preceptor is also, um, for yeah, it's very important as well. So make sure you approach your preceptor politely, and ask them. The main thing is, as Mark says, there you are confident to know about all those skills, but important is you let them show you once. Let them do first. Yeah.
Uh-huh. So
So
that's a common nursing preferred way of learning. See one,
mhm.
do one, teach one.
Yes.
And so it's okay to ask, can I go with you and see you do it first? And see if they'll let you learn in that way. Sometimes they're very amenable. Sometimes they're like, let's do it together. So you can be prepared for that too.
That's
Um,
right.
yeah. Sterling, is it possible the nurse is going to see these topics while they're doing pre-arrival and then they might see them again during their orientation?
Yep, absolutely. So, we have one course in particular that I've been thinking about as we've been mentioning preceptors, called a proactive approach to orienting with the preceptor. So, that is really going to set the nurse up for success in communicating with their preceptor, working with them day to day. It gives you some great examples of how to ask your preceptor at the end of the day, what did I do well today? What can I do better tomorrow? So that course in itself is really going to help you structure and know what to ask for your orientation. But certainly, there are many topics that we give in pre arrival modules that you'll see again. Some of the things that I think can be most helpful in those modules that the nurses will see right away is maybe equipment in the modules that they don't have back home. So then when they get to the floor, they see a certain piece of equipment and they're like, yes, I saw this in one of my modules, or even vocabulary differences as it relates to medication. So overseas, you may call a drug one thing, and here in the U completely different, but it's the same medication, whether we're using a generic versus a trade name. And then for those really important topics, for example, customer service, we may give you a course on that, but then your facility may give you a course on customer service as well. A lot of hospitals really pay attention to those patient scores, customer service scores. You'll hear a lot of that in orientation, and a lot of hospitals have their own policies and procedures as it relates to certain topics. So they'll certainly want to provide their own education as well.
Yeah, for sure. Fong, the Sterling mentioned a lot of topics that I know are really good, and I know you covered yours. But is there anything that when you think back, knowing what you know now, you wish maybe you had reviewed or spent a little more time looking at before you came to the U.S.?
Um, well, I think still the culture. Oh yeah, there's one more. One is I think the history and the healthcare system about the U.S. In the U.S. is quite important. When I first get sick, um, we have the primary care, we have the urgent care, and the emergency care. So back in Singapore, we it's totally different. So whenever you are sick, you can straight away go to the emergency room. So I made a big mistake, go to the emergency room. So yeah, I think we should include some of the healthcare system in our topic, maybe, so it's also benefit our candidate as well.
I completely can understand what you're saying. We have probably all counseled nurses who, the first time they don't feel well here, and have to access the healthcare system, it may be very early in their time. Things happen, and so
Mhm.
if you're thinking, well, this is what I did at home when I felt sick, it is very different here. There are acuity levels that are to be used, and also, if you go to the wrong one, it can be more financially burdensome to choose an ER for something that maybe could have been cared for in an urgent care center, or could have been even, we have a lot of telehealth options now that are coming online. So, you may be able to see a doctor online and then send a prescription to your pharmacy, and you're like, I didn't even have to go anywhere for this. So there's lots of things. And I think that's a great point. So thank you for sharing that. Um, so, Mark, what feedback have we heard from the nurses about the resources for pre-arrival preparation?
In general, we tend to get pretty good feedback on the resources that we send out. However, we're always looking to improve. So, if you are going through this process and you've gotten the modules and you said, man, one of these wasn't very helpful, but there was another one that was incredibly helpful, we want to know that feedback. But in general, we do a good job of evaluating periodically of what courses we think are most important, and we base that feedback on what our clients and what our nurse managers are relaying over to us of where was our challenge in the orientation period. So we take that information into account. One great example I always like to give, you need far more autonomy as a nurse here in the US. You're not going to be as dependent on the physician right there to make decisions in real time for you. So for example, when you call a physician and say, hey, there's been a change in the breathing pattern, they have some shortness of breath now, that physician is immediately going to ask you, well, what do their lungs sound like? They're not going to be telling you what their lungs sound like because they're not right there at the bedside ready to assess that patient. So that's where those modules and that feedback is important for us to know which modules we need to choose for you.
Mm-hmm. And the one thing that's really important when you're seeing that on the module is to take it and say, I haven't listened to lung sounds since nursing school. And if that's the case, find your family and your friends and your stethoscope and listen to some lung sounds, because it's really hard to start from the beginning when you're already here. And like I said earlier, drinking from the fire hose. So try to start applying some of that when you can, even while you're overseas. So don't just watch the module. Try and start saying, let me practice some of these techniques on the people who wouldn't mind being my practice patient. Or if the hospital gives you that opportunity, I've had people who will say, I talked to the attending physician. They understood that my goal was to go overseas. They knew already that things were going to be different. And they taught me some stuff about what they're looking for, what they're listening for. And now I can use that. So you can begin applying it even before you get here. AJ, this next one's for you. So when you start your orientation, which is coming up soon, what are you expecting is going to be different based on when you studied the modules? You go, you know what, that's going to be different for me when I go to work. So what are you expecting? Oh, you got to unmute again, AJ. There you
Well,
go.
a lot actually, because I came from the Philippines, and we know there's a lot of things and ways that are being still used there that are previously being used from the past years, but are quite different in here in the United States. So I think the procedures, the ways, and a lot of materials and equipments that are being introduced. And yearly, we know that there are lots of things that are being produced and being used in different countries. So I'm expecting more that I'll able to learn more and being taught. Yeah. So that's it.
Mhm. Yeah. And you mentioned procedures. You know, Mark, we talk about doing some Foley catheter insertion and the limitations that you may have with what gender you're allowed to start those with. There's also the fact that some places the materials that you'll use for the procedure are individually packaged. So you'll go into your supply room and you're going to grab each piece of that procedure. In the United States, a lot of those are packaged into a one package for the whole thing. So the procedure is assembled for you. And why do we do something like that? Why do we package it and put it all together like that?
The one is a time management piece, so you don't have to go searching around for each individual item. Two is also the field of sterility that you're going to use for that particular intervention. So, it sounds a little daunting when you first come up to this package and you open it up and you have 3 different sterile towels that you're pulling out, and you go, oh my gosh, which do I put where? I'm used to just setting my sheet under my patient, getting my supplies right here. So the main purpose is infection control of why those packages are put together the way they are, but also, time management. So you're not going and hunting pieces, but also going back to that infection control so you don't forget a piece that you may need, because we do have best practices and policies that we have to follow for inserting in a sterile environment.
Right. And breaking sterile field puts the patient at risk for an infection. We would rather grab a new kit if we've broken sterile field than put the patient at risk for infection. So it's very much about preventing any negative outcomes that might happen as a result of violating that sterile field, or perhaps doing the procedure in a order that even puts them at more risk, depending on what you're doing. All right, so let me just take a look here. I haven't read from who else is joining us. So I see Diane from Singapore, Zigal from the Philippines, Godfrey's in Canada, another nurse from Jamaica, Monique. Hello, Monique. Elma from the Philippines. Marcus is on. Han is in Kuwait. Walter is from Angola. And another nurse from Canada, Millie. Joseline from Brazil. And Youssef from Saudi Arabia, in Riyadh as well. So again, it's so awesome to see people from so many different parts of the world who are joining us. Fauzia from Kuwait and Murtala from Nigeria. Botswana is where Brenda is signing on from, and then Shiva from the UAE. So great to see you all here with us today. Thank you so much for joining. There is another question that came up from Nisha. She says, at what point exactly do we actually get the modules to complete? For example, 2 months before arrival. So we were talking about that a little earlier with Sterling, and I know depending on what organization you're with, they may time it a little differently. So it's not always everybody does the same thing. But Sterl, do you want to talk a little bit about that again? Just kind of recap.
Yeah, absolutely. So, what we mentioned earlier is we want to give these to you several months before you arrive to the US. I would say really 6 to 4 months before you arrive to the US is our goal, because we don't want you to be rushed right before you come to the United States. We require the courses to be done before you travel to the US, and we know those last few months before you pack up your family and move your whole life to the US is very stressful, which is why we'd like to get them done ahead of time, especially so you retain that information, you're not having to rush through the courses all at once, and so you get your CE credit, because some states in the US do require you to have CE credit in order to get a license. So we want our licensure team to go ahead and be able to start processing and applying you for that license.
Mm-hmm. So it's important if you're getting those a little closer to your arrival time for whatever reason, don't delay, because as Sterl mentioned, the closer you get to your arrival, the busier you are with all those preparations for yourself, your family, your finances, your work. And we know that some people do choose to kind of procrastinate, but it doesn't usually help in the long run with all the other things you have. You want to get the most out of this that you possibly can. So, Mark, the feedback that we get from the hospitals, what are the most common experience gaps that they perceive when nurses are orienting when they first arrive?
Yep, I would say in terms of ranking them, our top two are going to be policies, procedures, EMR. Those are usually the kind of the big ones. Next up, medication names are a pretty common focus as well. As many of you know, that our medication names may be a little bit different here in the US. We may have several different pharmaceutical companies that make the same type of medication with a different name for each one of them. Equipment, IV infusion pumps, there's some of those things that maybe if you're in a medical surgical setting, you probably didn't just have as much exposure to it. It takes a little bit of time and repetition to get used to those. And then as we kind of mentioned earlier, some of those, what we would consider more basic interventions for nursing interventions, such as IV insertion, urinary catheter insertion. So those are kind of the big five that we usually focus on and highlight on. Now, there could be some others that come up, as Sterling mentioned, communication, those customer service skills, those soft skills that we look at as well. And then time management, that's going to be a big one as well. You have been doing things one way, now you kind of have to learn how to cluster care and knock out several tasks at one time for your patient.
Mm-hmm. Yeah, that's really great feedback. And when you're thinking about preparing, that seems like a very long list of things that you're going to have to navigate through. Everybody's going to have a little bit of a different experience. Maybe they're more comfortable with adapting to how to manage time, but it also is when you have that opportunity to observe your preceptor working in that first day or two or three, that you're in that observation mode, you really want to soak it in and talk about it. So the more knowledge you gain about why they do things, maybe clustering care the way they do, the more you can start to adapt your thought process accordingly. I see Joy from Kenya has joined us, Hadija from Namibia, Agnes from Zimbabwe, and Zabzab from Pakistan. So again, lots more countries being represented here today. More than I think I've ever seen on the shows I've been on before. So it's kind of cool. So Sterl, you mentioned something earlier that I didn't really go back to, so I'm going to go back now, which is remedial modules or being assigned modules even once you're working here. So can you tell me what are the reasons why a nurse might need to even do some modules once they're here on as an individual versus the usual modules that we might give everybody?
Yep, great question, Holly. So, a lot of times, once nurses get to their floor, it might have been a while since they did the modules before they came, or they may just be seeing new diagnosis or equipment that they're not familiar with. And our clinical managers can make the recommendation, or the clinical managers at your hospital can always recommend to us that you get some additional education. But those can really run the gamut of anything that you may be experiencing on your unit that you're not totally comfortable with, or you just need some practice. So, for example, that could be titrating drips. If you are struggling with that in orientation and it's taking you a little bit longer than it should, we can assign some additional education to help you get up to speed with that task. Same for any different equipment. Our online learning platform is HealthStream, and they have some great courses specific to, certain pumps or even hospital beds. Any type of equipment that you may see in the hospital. how to insert a catheter, for example. Mark's mentioned that. But COVID was a great example too, because, within a period of several weeks, COVID-19 popped up and our nurses needed information fast. So if our nurses were deployed to a COVID unit or seeing COVID patients on their home unit, there was education readily available that we could assign to our nurses to help bring them to speed with what they might experience with a COVID patient. And that was a really great asset for us because it affected everyone all at one time.
Yeah, that's a very good example. Thank you, Sterling. Excuse me. So I want to talk a little bit about the technology differences. Mark, what are the biggest differences in training technology that are used here in the US to help nurses on board?
Yeah, some of the bigger differences are just going to be your exposure to the equipment. Even if you've had some experience with different equipment, and unless you're coming from a couple of the few hospitals in the Middle East have very similar U.S. equipment, but the technology and equipment is going to be a little bit different. Generally speaking, you should get some skills days and time with it in that general orientation period in those first couple of weeks. But more importantly, it's going to be on you to self-advocate for yourself as to where you need help with the technology you are facing. Different parts of the world may see different things. So for example, our nurses coming from our African countries going to need a little bit more with that computer time, the EMR orientation. Our nurses coming from some of the Caribbean countries may not see as many of those IV infusion pumps on their medical surgical floor. So they're going to want some more time with that. Our ICU nurses, perhaps, CRRT is not something that they complete in their current environment in ICU, but they're going to have to see that machine pretty frequently here in the US. So those are some of the examples that I see pretty frequently. Now, obviously, certainly not limited to that list of items as well.
Absolutely. So Sterling, when it comes to documentation, what is usually covered in our pre-arrival modules?
Yep. So we have one specific course called Professional Nursing Documentation, and that is going to give our nurses the very big, large scale overview of documentation in the US. Of course, a lot of our nurses are moving from paper to computer documentation, and that is certainly a big transition. So this course is really going to set up the expectations of what our nurses could see in the US. Now, Fang mentioned earlier that she uses Epic at her hospital. Holly, you mentioned a few others such as Cerner. So one thing that we wish we had access to was visibility into each of those systems. But because those systems are licensed out, we do not get visibility into each EMR system that you may be using at your hospital. So one thing that our nurses can do that is very helpful is if you know what EMR system you will be using here in the US, for example, Epic, Cerner, you can often go online, whether it's on YouTube or through different articles, and at least watch some videos so you can see what the interface of the system looks like. You can see, what each tab looks like. You can see what certain care plans look like. So at least it won't be completely, I would say, foreign to you. That's kind of funny. At least it won't be totally foreign to you when you see it your first few days of orientation. You say, oh yeah, I remember seeing this when I looked up these programs. But another piece of our pre-arrival modules that I want to touch on is typing practice. This actually is very helpful to our nurses who are currently on paper charting, because we expect all of our nurses to submit a typing certificate before they come. This is part of the pre-arrival modules. And we do that to ensure that your typing speed is up to par. Because if you are a very slow typer, or you're looking down at your keyboard and having to press each letter individually with one finger, it is going to take you a very, very long time to document. And quite frankly, you don't have time to type that slow. So that's why we encourage all of our nurses to practice your typing speed, make sure you're typing very fast, because then you're not looking at the keyboard, searching for the letter A to type out your notes. And unfortunately, that really does slow down our nurses if they haven't practiced that before they come to the US. But certainly that is one of the biggest and best things you can do is practice your typing and practice your computer navigation skills.
All right. So basically what I wanted to ask AJ kind of in follow-up to that is, what device did you use, AJ, to complete your preparation with your modules?
Well, what I did and what I'm comfortable with is using a laptop in comparison to only using my phone, as it gives less stress to my eyes, and I'm getting quite comfortable in using it because in the long run it will help me during my duty times, and yeah, laptop is better than personal computer in my personal opinion, or a phone.
Okay, so I appreciate you sharing that perspective. I think that also makes it, of course, applicable for the typing that Sterling mentioned earlier. And if you don't have a computer accessible to you, a laptop or a personal computer, and you don't have an easy way to get one, you may need to take the effort to borrow from a friend or family member who has one. It is worth the effort to be able to practice these things and become more skilled in using those devices. Think about it this way. If you are learning so many new things and having to demonstrate competency in so many new things, and you're not comfortable using a mouse, or like Sterling said, you're doing what I call this hunt and peck. This is where you're hunting for the key and you're pecking with your finger on that individual. It's slowing you down, and it's something that can be addressed while you're still here. So it may seem, oh, that's silly. Why would I worry about that? But it truly can help you to have those skills already in place and be comfortable when you're learning so many other more, I don't know, maybe higher priority topics and skills once you get here. Okay. I just want to mention that Kinetics, in the chat, you'll see we've posted about a referral option bonus for you. If you know nurses who have their NCLEX, those RNs are great to refer to Kinetics. So the link is listed in the chat as well as here on the screen for you. If you're one of those nurses or you know someone, we would welcome the opportunity to provide you with a bonus for that referral. So check it out on this link. It'll give you some instructions on how to make that referral and how to be recognized as the referral source, which is really important to make sure that if we actually are able to bring that nurse on board into the US, that you are recognized as the person who should get that bonus. Ranke is from Nigeria. Thanks, Ranke, for joining us. And Safura from Saudi. Thank you so much to you for being here today. So the last thing is some final advice, and we've got just a couple minutes left. So from sort of around the group, and I'll start with Fong, what was one piece of advice you'd give to nurses to help them prepare for the difference in their role in the US? Just one. I'm sure you have lots.
Oh yeah, okay. So just one, okay? Be at your own pace. So I know this doesn't mean that you can always you know be slow, or do things really enjoy, you are enjoying the time as doing your things alone. It's only what I mean is you plan your pace, because why am I saying this is because you are new to a new environment, and planned pace will make you be more confident and digest all that you learn in 1 day or 2 day. Maybe I give an example. For the first week you can take up to 1 to 2 patients. Don't exaggerate that. You will be at stress if you take more than that, no matter what reason. Yeah, so that's the time for you to learn. And 1 to 2 patients, if you are confident with one to two patients, then you can go on. If you still cannot, tell your preceptor that you are still not comfortable and you need some more time. Yeah, be at your own pace.
That's great advice. And Sterling, I'm going to have you go next, and then AJ, and then we'll have Mark round it out.
Thanks, Holly. So my advice would be to take your pre-arrival courses seriously. I know that sometimes you look at your list and it seems so long. We give you 3 months to complete those. So if you could prioritize one course every other day or every third day, however that works out, you're really going to retain that information. You're going to get the courses done gradually. You won't be saving them till the last week before they're due and you're stressed. And when you think about the time it takes you to complete your courses now, really think about what all you're going to learn and how much time that is going to save you once you're in orientation, because you may learn several things in your courses that's going to save you a lot of headache and trouble in orientation because you're already going to have exposure to those topics.
Right. All right, AJ, you're up next. What is your piece of advice?
So I think I'll just give it an overall. So just prepare yourself physically, mentally, and emotionally, because you'll be introduced to a lot of different people and a lot of different attitudes. So just prepare yourself in all of those aspects.
Good point. Yep. There's going to be a lot coming at you. So the more you work to prepare ahead of time, it's kind of like if you are planning to run a marathon, and that's kind of what this is, then you want to make sure that you do some practice marathons and you want to train for that and not just expect that when you get here, you can run the marathon without having done some work ahead of time. All right, Mark, last but not least.
Well, I really love all those pieces of advice that everyone's given. So to kind of round it out, my biggest piece would be to know that you are the go-to person in your previous setting, and you're coming here, you're going to almost feel like you're a new nurse at times because there's so many differences that you're learning on the fly. So my main piece of advice with that in mind is embrace the conversations that you have with your preceptor, your nurse manager, educator, where you are identifying areas of improvement. So areas that you need to do better in. It can be uncomfortable. It can be sometimes a little bit disheartening sometimes to hear this feedback because, like I said, you were that expert previously. But the more you embrace those areas, the better and the stronger nurse that you are going to be as you come out of that and you learn from those experiences.
Absolutely. Completely agree. Great advice. So I want to just close out by talking about, well, I'm going to answer one question here. So Caesar, you asked, where can you find the modules? So depending on which organization you work with, whether it's one of us with the AMN International, or if it's another organization that you're working with, you would have to ask them what is the platform that you're using to do the training and work with the team there to get you assigned. So usually the access is given by the company that's facilitating that for you. However, let's say the company that you're working with doesn't provide that. I still think it's worth you looking at some of the topics that we mentioned and talked about online. There are a lot of companies out there that offer continuing education on a wide variety of topics. So when you do some research online, you'll find free YouTube videos. You'll find even free continuing education. Sometimes it's not maybe as pretty audio visually as some of the modules that we might be able to give you access to, but the information is still there. And if you want to invest a little bit financially, there are some companies that offer like subscriptions where you could get a year of access to continuing education modules with hundreds of topics. And it might seem like, oh, should I put my money there? But truthfully, it is an investment in yourself to help you have an easier time transitioning in the future. So that's what I would say for that. With the Kinetics College, we do have some topics that we excuse me, that we are covering in the next few weeks. So for those of you who have yet to do your NCLEX, you may find it very helpful to attend a Kinetics College NCLEX class with one of our NCLEX partner instructors from either Aspire or iPass. So every month we have some guest lecturers come in and join us and share some really relevant topics. There's lots of great content surrounding the upcoming next generation NCLEX that starts April 1st, as well as some key topics that are going to be covered by the NCLEX that are important for international nurses to understand. And we also offer English preparation topics with Swoosh and Niner. So you'll see that we have something being covered every Monday for the Kinetics College. And depending on what milestone you're working on to get yourself here to the US, those resources are available open source, just like this particular web show. So we invite you to join us for that. Remember that if you're interested in applying yourself, you can go to our website. Our link will be listed in the chat as well as right here on the screen for you, kineticsusa.com/apply. And don't forget about those referral bonuses for your RN friends. Take a look at that link as well, kineticsusa.com/referral. Thank you so much to all of you who attended today. Please join us for future sessions. We're going to continue to cover clinical transition type of topics and figure out what we can do to continue to help you grow and prepare for your eventual U.S. nursing career. Thank you to our guests who joined us today, Fong, AJ, Sterling, Mark. It was great to see all of you. Hope maybe we can see you on some future sessions. Thanks again to everybody. Hope they have a good rest of your day or night. Take care.